Hello everyone, welcome back to Whole Health. Today's topic is all about kidney stones, what they are and why people get them, and the best treatments available including some of the latest research from medical colleges. Kidney stones can cause intense pain and discomfort, but understanding what causes them and the science behind their treatment can make a huge difference. So let's get into it. Before we dive into the topic, please don't forget to like and comment and subscribe to the channel. What are kidney stones? First things first, let's talk about what kidney stones actually are. They are hard, rock-like deposits that form in the kidneys from minerals and salts that concentrate and crystallize in the urine. Usually, the kidney filter out waste and excess minerals without any issue. But when urine becomes too concentrated, these minerals stick together, forming stones. Kidney stones come in several types, with calcium oxalate stones being the most common. We also have calcium phosphate stones, uric acid stones, struvite stones, and crystalline stones, each with slightly different causes and treatments. Why do people get kidney stones? There are a few main factors that can lead to kidney stones, and understanding these can help us prevent them. Let's break it down. Number 1. Dehydration. One of the biggest risk factors for kidney stones is simply not drinking enough water. When you're dehydrated, your urine becomes concentrated, creating an environment where stones can easily form. Researchers from Harvard Medical School emphasize that people who drink more than 2 liters of water daily have a significant lower risk of developing these stones. Number 2. Diet. A diet high in salt, animal protein, and oxalate-rich foods like spinach and nuts can increase your risk. Salt raises calcium levels in urine, while foods high in oxalates contribute to calcium oxalate stones. Studies from the University of Chicago found that individuals who reduced sodium intake saw a 30% decrease in calcium excretion, which lowered stone risk. Number 3. Genetics. Family history plays a role. If your family has a history of kidney stones, your risk goes up. According to the Mayo Clinic, genetic factors contribute to kidney stones for about 30% of those who develop them, especially crystalline stones, which are rare and genetically driven. Number 4. Medical conditions. Certain health conditions like obesity, diabetes, and gout can increase your risk of developing stones. For instance, the University of California, San Francisco found that people with type 2 diabetes had an increased likelihood of uric acid stones, likely due to higher acidity in their urine. Symptoms of kidney stones. Kidney stones often go unnoticed until they start moving around in the kidney or pass into the ureter, the tube that connects the kidney to the bladder. Here's what people commonly experience. Severe pain. The pain often starts suddenly, usually in the lower back or side, or can radiate to the lower abdomen and groin. Painful urination. When stones move closer to the bladder, you may feel excessive pain while urinating. Blood in urine. The movement of stones can scratch the lining of the urinary tract, causing blood in the urine. Nausea and vomiting. As the stones move, the body may react with nausea or even vomiting. How are kidney stones diagnosed? Once symptoms appear, doctors use several methods to diagnose kidney stones and figure out the best course of action. The most common tools include imaging tests like CT scans and ultrasounds, as well as blood and urine tests. CT scans. CT scans are the gold standard because they can detect even the smallest stones and give a precise location and size. Blood tests. These help identify high levels of substances that might be causing the stones, like calcium or uric acid. Urine tests. A 24-hour urine collection can identify high levels of minerals that contribute to stone formation or a lack of substances that prevent stones. Research from Johns Hopkins University shows that urine tests are about 90% accurate in diagnosing and understanding the cause of stones, which is crucial for choosing the right treatment and preventing recurrence. Before we talk about the treatment, Please don't forget to like, subscribe, and share the video. Treatment options for kidney stones. Now let's talk about treatment. The best treatment often depends on the size, type, and location of the stone. Number 1. Hydration and pain management. For small stones, drinking water up to 2 to 3 liters daily can help flush the stones out naturally. Pain relievers like ibuprofen are often recommended to manage discomfort. A study from Cleveland Clinic found that 80% of small stones can be passed naturally with adequate hydration and pain relief. Number 2. Medications. In some cases, doctors may prescribe medications like alpha blockers, which relax muscles in the urinary tract, making it easier for stones to pass. Harvard Medical School found that these medications can reduce the time it takes to pass a stone by nearly half. Number 3. Extracorporeal shockwave lithotripsy, or ESWL. This is a non-invasive treatment where shock waves are used to break larger stones into smaller pieces, allowing them to pass naturally. According to a study from the University of Washington, ESWL has a 70% success rate for stones smaller than 2 centimeters. Number 4. Urethroscopy. A urethroscopy involves using a small scope passed through the urethra to remove or break up stones in the lower urinary tract. It's especially effective for stones that are hard to pass naturally. Research from Mayo Clinic shows that urethroscopy is about 90% effective for stones located in the lower urethra. Number 5. Percutaneous nephrolithotomy. This surgical procedure is for larger or more complicated stones. The surgeon makes a small incision in the back to access the kidney directly. Medical studies indicate that percutaneous nephrolithotomy is over 95% effective for removing stones larger than 2 centimeters. Now let's talk about how to prevent kidney stones. Hydration, diet, and regular checkups are the answers. The best way to manage kidney stones is to prevent them. Here are some science-backed strategies to reduce your risk. Number 1. Stay hydrated. Drinking enough water around 2 to 3 liters daily is one of the simplest and most effective ways to prevent kidney stones. A study from the University of Pennsylvania found that people who drank more than 2.5 liters of water daily had a 60% lower risk of stone recurrence. Number 2. Limit salt and protein intake. High-sodium diet raises the amount of calcium in urine, while a high-protein diet increases uric acid. Cutting down on both can reduce stone formation. Research from Stanford University shows that individuals on a low-sodium, plant-based diet had fewer kidney stones over a 5-year period compared to those on a high-salt diet. Number 3. Calcium-rich foods. It might sound counterintuitive, but eating calcium-rich foods can actually help prevent stones by binding to oxalate in the intestines, reducing oxalate absorption. Mayo Clinic research supports this, showing a 20% reduction in kidney stones for people who included calcium-rich foods in their diet. Number 4. Limit oxalate-rich foods. For those prone to calcium oxalate stones, limiting foods like spinach, nuts, and chocolate can be helpful. Research published in Journal of Urology found that individuals who followed an oxalate-controlled diet reduced their stone recurrence by 50%. Number 5. Regular checkups. Getting regular urine and blood tests can help monitor levels of stone-forming minerals. Early detection and preventive strategies guided by your healthcare provider can make a big difference. Future treatments and research directions. Exciting research is also underway on the future of kidney stone treatments. Medical colleges are exploring innovative approaches like dissolving stones with targeted medication and using new technology for non-invasive removal. For instance, researchers at the University of Michigan are studying a potential drug that could dissolve stones over time. Meanwhile, MIT is also working on ultrasound technology to help identify and treat stones before they grow too large. These advancements could one day reduce the need for invasive procedures. And that's everything you need to know about kidney stones. With the right prevention strategies and awareness of the latest treatments, you can protect your kidneys and manage your risk effectively. If you found this information helpful, don't forget to like, subscribe, and hit that notification bell to stay updated with more health content. Thanks for watching.